Hello, this is Dr. Stanley Lang, and welcome to this broadcast. The question that I have for you today to encourage you on the path of a healthier lifestyle and one that is focused on health of body, mind, and spirit is how does eating or changing your diet gradually decrease your stress and contribute to what we'd say chronic stress management? How does a gradual change in diet do that? Now, before I answer the question, I want to remind you that the context for this uh, presentation is that we're approaching health in a whole person way, that is health of body, mind, and spirit. And we're trying to understand how to best access those parts of us so that we can be as healthy as we possibly can using the strengths that our body, our mind, our spirit have to move us on the path of wellness. So what I notice in a lot of people is that once they set a goal to try to lose weight, the moment they say, okay, I'm going to do that, at that point they feel more stressed because all of a sudden they have now formalized the distance between where they are and where they want to be. Before, it was just kind of in their mind that they weren't happy with where they wanted to be, but now they are more clear that they're not where they want to be because they've actually set this goal. And when people have a big difference between where they are and where they want to be, that creates the feeling of chronic stress, particularly if you don't have some simple way in your mind of how you're going to get from one place to the other. Recently, I was seeing a patient that had successfully lost weight twice and controlled her diabetes completely without medication twice, and had also fallen off the wagon, so to speak, over the years, had regained some weight, not all of the weight, but had regained enough weight that she was no longer in good diabetic control. And she was despairing that this had happened again. And where do you go from here? And so the suggestion that I have for you, if you're feeling similar to what this lady was feeling, like I've fallen off the wagon a lot of times and I just can't set the big goal anymore. I don't have confidence that a big goal. If that's where you're at right now, then what I suggest is a gradual approach where you use a pre-meal meal, a first course for your meal that basically has a plate that is divided into thirds, and the thirds are protein, vegetable, and fruit. Now, if you use this approach, the idea is that you don't set anything off limits. That way you're not telling yourself you can't have that and you can't have this, but rather you're focusing on eating this first course of your meal before you eat the rest of your food. And when you do that, you take away from yourself the stress of saying, I can't have this or I can't have that. And if your promise to yourself is that you're just going to eat this first course first, always before every meal, that allows you to move into this place of gradual change from where you're at to where you want to be. And the size of this plate can gradually increase. And as it gradually increases, the amount of food that you're going to want to eat for the second or the third or the fourth course, the other foods that you might be craving, it's going to gradually decrease. That's been my experience with a lot of patients. And I think that it's probably what you would experience too. If you will just promise to yourself that you're going to eat this what I call modified plate, protein, vegetable, and fruit in even amounts. You're not measuring any calories. You're just eyeballing the different portions. If you just promise yourself you're going to do that before every meal and every snack, and that's the only expectation you're setting on yourself, I believe that your experience is going to be that you can gradually arrive at the place that you want to be and relatively painlessly let go of the things that you right now don't want to let go of, or you're afraid of trying to let go of. And if you do this gradually, you're going to experience that it is not stressful, that it doesn't feel like the huge stress of starting a big dietary change or cutting out everything that you love all at once. So I encourage you to do this gradual approach because it works really well to undermine the part of you that doesn't want to let go of these foods. And so that's like, it's kind of like a minefield that you're walking through. You have these desires that they're still there strongly, and the moment you step on that mine, it blows up, and all of a sudden you undercut yourself completely by eating all these foods that were off limits in your mind. Um, and if you've done it gradually, you never tell yourself that anything's off limits. You just gradually let go of them, and that's what you will do as you increase the size of this first course more and more and more and more gradually. And again, there's no rule with that. You can increase it as slowly as you want or as quickly as you want. So if you do this, I think you'll experience a lot less stress with the process of making dietary changes, and that will decrease your stress in two ways. Number one, as you eat better, your stress is going to dramatically decrease because your body's chemistry is going to be better. Number two, the stress of trying to follow a diet will be a lot less because you're just putting a first course into every meal, and then whatever else is on the second course, you still give yourself the freedom to eat that. I wish you well. Hope you follow this with success. Share it with your friends and family, and God bless.